We would love to take a couple of your questions before we take a break. I have permission from the leaders here, so if you do have one, and we already do, thank you.
Right.
All yours.
Right. I'm Scott Faulkner with the Photobiomodulation Institute, but to you, Lucy, the basics of loneliness is that parents need to become parents, families need to become families, neighbors need to become neighbors. That so many places in America, it's name only. Parents are offloading their kids to sports and to the school system. They're not reading to their children. They're not doing enrichment activities together. They're not going out and doing activities. Families, the intergenerational thing of having grandparents being able to tell their stories. Even people, because my mom suffered from Alzheimer's for 7 years, and being able, because the memory, the long-term memory is the last to go, so to have them relive their childhood or their dating of my father and all that. I mean, how to be able to use that as a way of bonding. And then also neighbors. Being able to, Zan and I live about a mile apart, but we both live in neighborhoods where we literally have each other's keys. We look after each other when people are ill health, check on their pets. Those very basic things that bring people back together and prepare the next generation to be viable, productive, functioning adults. I'd love to hear your thoughts on how do we, because that's not a big federal program, that's not even a state or a town program, that's literally from the heart and making people understand there's a commitment to each other and to the next generation.
What you said. Thank you ever so much. How you change heart and minds clearly is the biggest question for all of us all the time, isn't it? It's not easy to do. In New York City, I get the great pleasure of watching dogs in a dog run. They all play together. They all know how to do that because they grew up doing that. It's amazing how when I watch that, it strikes me as people. When we live together as people in a small village, like the original ones, we begin to think that way and act that way. But how we change heart and minds, I don't know. But what I do know is there are programs that could help us do that better. As we think about how we design our cities of the future, as we think about how we design our apartment buildings and all the things that we do, and city planners are all over this. There are ways to help us come together in more powerful ways. But just due to time, I think Chef Carl actually would have to respond. Perfect. Thank you.
One of the things that for all these years at the school, I saw many students, and one shocking element of that was that many of them actually never had a family meal together. And when you talk about loneliness and disassociation and things, that is a tragedy, actually.
Speaking of, one of Chef Carl's main things is how to use food to bring communities together. Because all chefs, I think that way, but that's a very important piece of this. I just see lots of folks lined up, so would you jump into, Chris? I want to include as many as we can.
Okay,
yeah.
Very quickly, just
Yes,
to give some examples to deal both with loneliness and the aging population. Like if you look at Japan, they try to integrate elderly people into the society much more, like helping children cross the street at a school and greeting people in a shop and so on. And in Israel, there are other programs, for example, where they combine a nursing home with a kindercrash. So the old people, they sit there and they see the children walking in and they stay there the whole day. And it's just amazing to see. You have to go online and Google it and watch the YouTube movie. So these old people, they blossom up. Instead of sitting the whole day in the seat watching television, they have the children around. So there are a lot of great initiatives to deal both with loneliness and huge increase of aging population.
Well, and they're program after program when you come to think of things like that in particular, but getting at the concept of how do we change families and how do we get at the root of that is an entirely different story of its own, to your point. Yes?
Yeah, so I was interested about anorexia of aging or anorexia of the elderly, and I was wondering if either Chef Carl or Chris has any ideas about that, or even Chef Carl, if you're working with any of the hospitals to make the food more palatable as we're trying to make sure that the elderly are putting on the appropriate weight or have the appropriate amount of macronutrients.
Yeah, so one of the things, I mean, I'm not an expert on anorexia, but I do know that we have worked with Tulane And also in our nutrition program, our students that go out, they go in the nutrition program, they go out into the hospitals, they do internships, and they work with recipe modification and also addressing individual needs of either on the obesity side, but really getting them into the kitchen and working with them into the kitchen so they make food themselves. And that has a great impact. But it's the same for children. When you have kids, one of the biggest benefits of educating children early on, let's say, for example, through edible schoolyards. I'm sure you heard of that. It's one of the best thing to have, and they're incredibly successful. Because we always say kids don't like to eat vegetables, or you can't make them eat certain things. But you make them go, and my son worked in the school district for many years, and they've introduced that. They would eat anything that they grow, and they were happy with that. They were edibles. Yeah, these are in elementary schools. They have a schoolyard, and they make a garden, and they grow vegetables and fruits, and it's pretty successful.
Fantastic, thank you. Chris, did you have?
Yeah, it's a very difficult problem to address to make all elderly people enjoy their meals much better, because if you look, for example, at the tongue, the taste buds they decrease tremendously when you get older. So the best way is just to try to rejuvenate the people with new treatments, biotechnologies, so that you can bring back this taste bud density and the neural connections with the brain and so on. So that would be going to the root cause, of course. But otherwise, there are other ways like improving the taste much more and using healthy taste modifiers like stevia, which is 300 times more sweet than sugar, but it doesn't cause the sugar peaks and so on. So there are ways to make the food much more taste dense, and that also change the texture and so on, so that people can enjoy it more. And also, for example, like specific vitamins and minerals like zinc can also improve, let's say, your being hungry and then enjoying your meals more. So. But it's a difficult thing to tackle.
Thank you so very much. Two of you, we'll get your two questions, but just one more quick thing from Chef Carl.
I'm sorry to bring back to answer the question again. Another thing is very important. That's a passion of mine as well, and I've been very happy to be involved with having alternative meals and having products that are available to address various things. You tasted some of the food outside that we had. Comes from a Healthy Meal Supreme that was brought, and very, very passionate about healthy alternatives to good meal that addresses all the issues of healthcare.
Super, thank you. We'll take these last two, and then we'll call it a day. Yes.
Hi, my name is Eric Hillstrom, and I am based in the UK, despite the accent. I'm involved in a variety of programs over there, and in addition to a Minister of Loneliness, we have What Works Well Center for Loneliness, which is a great resource for addressing loneliness. There's a lot of evidence around the burden of loneliness. There's not a lot of solid evidence about what to do about it. It's actually an area that still requires a lot of really good research around all of that. And there was a slide earlier on blue zones. The blue zone slide was missing the community element, particularly the decline of the family structure.
Yeah. It's in the slide at the bottom, but you're right. It's very important.
And I did mention that actually in mine, the piece about community.
That's right. And spirituality is another aspect of the blue zones that I'm not sure was in the slides. But having said all of that, we're involved in the UK, we have a Healthy Newtown program. So with a single payer system, the National Health Service recognizes the relationship between the physical environment and our health. And so they're looking at standards for healthy new towns. So how do you design the physical environment to help your health? But what's missing in that is the people aspect of it. So it's the people that make a place. And so we're in the process of creating strategy around community building. And food is a key part of that. So one of the town I'm involved with is in just outside of London called Ebbsfleet. And there's Edible Ebbsfleet, which is a program of kind of public allotments. So you come along, anyone in the community can eat from, pick the food from the community. So it's a program that brings people together, and it's a useful program. So anecdotally, there are various programs that bring people together. Another one of those programs, as you were saying, is around food. There's a Dutch program, some good research, an academic out of Arnhem and Bussel, that brought elderly people together, and it's the process. You couldn't go to the meal without inviting someone else. And what happened was that the process of planning the meal, having the meal, brought everyone together. So food is a great way to bring all of that, and it brings in, the Healthy Newtowns also brings in exercise. Sorry to go on, but I think I guess the aspect is, you know, the interventions and the evidence around the interventions. If there's any thought from the panel, that'd be great.
Anybody have any thoughts?
Just final comment, General. I think one reason we've been so successful in Dallas, when patients come to us, have a very thorough evaluation, one of the most comprehensive evaluation in America. Number two, it's educational motivational experience. We only see 3 patients or 4 patients a day max. Number 4, we give them recommendations how to change their lifestyle that are safe, effective, realistic. And number 5, we get them back. Great return. That's why patients do meet the goals we established for them. One final point, too. People ask me how I've been so successful in a very difficult field over the last 50 years. When I started from scratch, 2 offices and 2 employees, and now we're all over the world. Number 1, I'm very strong in my beliefs. Divine intervention. I wouldn't be here today if the Lord hadn't guided me all the way. Number 2 is a fantastic staff. Any CEO is going to be just as successful as his staff makes it. Number 3, we've proven it's cheaper and more effective to maintain good health than regain it once it's lost. And number 4, people realize they have a need, and you provide a service. They get the results they want, they'll make you successful in any field. That's our keys to success.
Thank you. Anything you want to add? You good? Okay. Chris? Okay. Then one more last question then, and thank you ever so much for sharing about Newtown. That's lovely. Thank you so much. It would be wonderful to have an entire conference around Newtown and about what can we do and what does it mean to help each individual and create community. So I suggest, Zan, that maybe we think about that as a follow-up. Last question.
Yes, and it is a question. I think Dr. Cooper could answer it, but everybody may want to join in. I'm Adrienne Berg, and I'm a radio podcaster and a blogger. And I speak directly to the consumer, to people who are 40 to 90 years old all the time. But I go to these conferences, from United Nations to this one to Leading Age coming up. I'll go to 5 this month. And I want you to know, this may make you happy. Even though they're siloed, everybody's in accord. All the information that you gave today, from loneliness kills to the need for the Mediterranean-style diets to the fact that medicine is a food, that food's a medicine, and everything else, we all know it, and we're getting the information. My question is this: I talk to the same people constantly, hundreds. Some do it, some don't. What I'm looking for is what do you feel the positive deviant is? The individual who will take this piece of information and really use it, as opposed to the rest who will continue the same lifestyle that they have over and over again. And I'm sure that people who come to your center are the positive deviants. And if we could see what they are doing differently with the same issues, we may really be able to educate the public in a slightly different way to make them really take self-care into their own hearts, because the government won't do it. I see what's happening.
Thank you.
Yeah, it's an issue that I would really like to solve. So what's the profile of the people who take what you're saying to heart?
Great question. I'm going to turn it over to you just momentarily, but I think there are 2 pieces here I'd just love to address. The first one, and then turn it over to you for the big one that she just asked. One, and the other piece is, what do we do up front? How do we educate from birth? How do we change a culture so that we're actually doing it not from how do we change the deviants who are not doing it, or what is the difference in adults who are or aren't, but how do we raise the next generation who all are, if you know what I mean. And that's a change in attitude, it's a true change in focus. But for your actual question, I'll throw that right to you, which is where she wanted it to go.
As I said, 54% of our patients are corporate sponsored. CEOs in America are realizing they pay a lot when they lose a man for a heart attack. So they're getting those patients down, and we pick up disease all the time in people that think they're perfectly healthy. So they have the proper motivation, number one. The CEO comes, he encourages his employees to come. You think we have a very restricted population. Those employees that come in don't always want to come. Some people came in because they're in great shape. They want to show off. Used to be that way. Wealthy people, no. I have many, many complimentary patients that I see. So we've cut it down to the extent that we have a more broad base of what we're doing too. I'd like to make a final comment too. As I said before, I've just frustrated over the years in trying to get this concept of wellness into the minds of the politicians in America. I was nominated twice to become Surgeon General because George Bush has been my patient since 1968. I see him regularly. So I went to Washington, I went to HA Secretary to be nominated. And I told him I want to concentrate on childhood obesity and diabetes, adult obesity and diabetes. He said, no, I want you to concentrate on AIDS, avian flu, and bioterrorism. I said, that's not what's killing us. He said, I know, but you're wasting your time in Washington. This is back several years ago. Wasting your time in Washington. There's been 9 bills submitted by members of Congress who want to do what you want to do. 1 by Ted Kennedy, 2 by Bill Frist, 1 by John Cornyn. 8 bombed out in subcommittee, 1 died in the House. You're wasting your time in Washington. Go back to Texas, come in the back door. Went back to Texas, met with Governor Perry. We started FitnessGram testing in Texas, couldn't do anything in the national, and now our FitnessGram testing for program is going all over the world. Because you're exactly right. We've got to start with the children first, because they're going to become adults. Obesity, diabetes, and Seattle hepatitis in children we're seeing in Texas, unparalleled. We've had obesity epidemics. In 1990, we had 33% of our adults overweight. We have 70% of adults overweight obese now, 13% of our children, 36% of our children. We're in the midst of obesity epidemic, go on and on. But remember, too, that obesity is a metabolic risk. It increases the risk of cancer, heart disease, all the things. Sorry to take us along.
If I may add to that
well
very
done.
quickly. So I think we really want to change the health of people, but sometimes people, they don't want to. So the biggest mistake we can make is to think, a lot of people, they often think that everyone thinks like themselves. And sometimes we are all very health-minded and so on, we want to live longer, but some people don't want to live longer. So I had patients who already had 3 strokes. And I said to that patient, you really have to eat much healthier and so on. But she didn't want to, and she even wanted to die. So she really didn't care. So you really have to respect sometimes how patients think, and often they can think completely different than us. But then to come back to your question, I think what's very powerful for patients to convince them to live healthier is to provide them with alternatives. So you said, like I said, instead of saying no red meat, just replace red meat with chicken and so on, or give people alternatives, and then people can see you can eat very healthy, very delectable and so on, because a lot of people think, well, healthy food is not delectable, it's not palatable, but you can eat very well if you provide alternatives. I think also engaging the family, also explaining to patients the power of nutrition so that you can substantially reduce risk of heart disease and slow down aging through these and that mechanisms. So I very strongly believe in patient education, and the problem is I see a lot of colleagues saying, well, they don't bother giving all this health advice to patients because they already decide beforehand the patient won't understand it or is not going to do it. I think it's our job as a medical doctor to provide all the convincing evidence for how powerful nutrition is, and then it's up to the patient to decide whether he or she will follow it or not.
Wow. Amazing. What a session.